We're going to talk about the stomach chi. There are two parameters that we're going to check in order to determine if we need to treat the stomach chi line. The first parameter would be taking the pulse. We will place 3 fingers on the radial artery, starting with lung 9 and placing 2 fingers proximal to that. And what we want to do is we want to evaluate the shape of the pulse, the quality of the pulse, and to see if it is indeed a wave shape, which means can I feel the pulse coming from proximal through the arm all the way distal to the fingers, through my fingers, meaning I want to feel a wave. Often it is very difficult to determine if indeed I feel a wave, but the two easy parts are if it is really pecking, meaning the pulse just taps on the fingers without movement, very clearly we call it a pecking pulse, or when we can really strongly feel a wave. In these two cases it is very clear. In the first case we will find a point at the anterior lateral aspect of the tibia that will change the pulse quite immediately, which means we will slide our finger, every bump that we meet will stop, press on that bump and see if it changes the pulse. If not, we'll move it a little bit further, stop there, see if it changes the pulse, and if indeed we have one of the points that changes the pulse more, we will then insert the needle in a 15 degrees angle with the flow of the channel, very shallowly, and then recheck the pulse again. And recheck the pulse again. If we're convinced that now the pulse is flowing well, we can imagine and feel a wave, we leave it at that. Sometimes it happens that the pulse actually sinks and we find that the pulse becomes thready. We'll take the needle out and we will redo the exact same procedure. There are many cases where we are not sure whether the pulse is moving or not, and it takes a little bit of a training, so we'll place the fingers on the pulse and we'll just move the finger from bump to bump and see can we actually find a strengthening of the pulse or a moving of the pulse, and we'll just go by that. When we start the treatment of the stomach chi, we'll start with the left side, and if you have a pronounced change and the pulse is flowing nicely, we'll just leave the needles on the left side and then do other kind of treatments such as the adrenal, the Shaoyang, etc. Sometimes the stomach chi line on the left will move the pulse somewhat, and then we can add stomach chi on the right side. Note that in some patients, when the area is relatively atrophied, or in some patients where we cannot find any bumps that are holding our movement and giving us points to treat, we will go to the two classic points, stomach 37 and stomach 39, which are the large intestine and small intestine He points, and these are also the antique Chongmai points. These 2 points can actually together move the pulse even in areas where it's really hard to find any kind of bumps or any kind of stomach chi myogelosis that we put the needle in. So we start at the left side first. If we have satisfactory results, we leave it at that. If the results are not quite satisfactory, but we start to feel the movement of the pulse, then we can go and put 1 or 2 needles in the right. We usually do not put more than 2 needles on each shin, but sometimes 3 needles are better, but in most cases 2 are sufficient. The second parameter of stomach chi would be palpating CV12 area. The CV12 area is often called the stomach chi, and is often also quite sore by palpation. If it is indeed sore by palpation, the two most important channels to treat are the spleen and stomach meridians. In terms of the spleen, we can go to spleen 3, press with the flow of the channel, and then press again on CV12. We can go to spleen 6 and do the same, and spleen 9 and do the same. If each one of those points have reduced pressure pain on CV12, we will needle them, and if the foot is cold, needle in moxa. If that does not work, we will go, as described before, point by point on the stomach chi line and find one point that potentially reduces the pressure pain at CV12. In TCM, the classical point would be stomach 36, and we can actually start our investigation with stomach 36. Sometimes it yields good result, and the pressure pain at CV12 will disappear. Sometimes neither the spleen nor the stomach channel yield any kind of result, and then we will go and check the back. We will ask the patient to sit up while holding CV12. We will hold CV12, make sure that we have the point that is actually painful, and then go to the left side, bend a little bit forward, yeah, like this, left side, spleen shu, a little bit outside spleen shu, which is bladder 49, and press on that, or we can go a little bit outside of the heart shu and press on that bladder 42 region. One of those 2 points should reduce the pressure pain on CV12. If it does, the way that we needle is again flat down with the flow of the channel. Make sure that the patient will feel a reduction in pressure pain on CV12, and then have the patient lie down on the needle as such, and then we can do our Ketsu immune and other kind of treatment.